complexities of health insurance are best addressed by experts, we have invited members of the ChamberCare team to provide an overview of the program, including an explanation of the process and benefits these plans offer. We would also like to formally thank the Indiana Chamber, Indy Chamber, and SIHO for their continued efforts to expand and improve the ChamberCare program and make it accessible to chambers across the state. Please join me in welcoming Brett Hulse, the Vice President of Investor Relations with the Indiana Chamber of Commerce, and Emily Koshnek, Vice President of Membership with the Indy Chamber. Brett and Emily, we invite you, well, Brett, I suppose you'll come up. It is, we'll just be Brett. We'll come up and he'll start his gig.
Okay, thank you. Thanks, Frank. Move this over here. Not sure if I'm presenting or if I'm remonstrating against some zoning proposal or testifying. Well, like Brian said, my name is Brett Holtz. I'm the Vice President of Investor Relations at the Indiana Chamber. That means I lead our Indiana Chamber kind of membership efforts, and I also kind of oversee the ChamberCare offering that we have in conjunction with my friend and colleague Emily at the Indy Chamber. So very excited to be here and to talk to you a little bit about the ChamberCare plan. What's new? What's the same? How you and your fellow business owners and can take advantage of the program potentially. So let's proceed. So the ChamberCare plan was launched in 2019, and it is a MEWA plan. And has anybody ever heard of a MEWA plan before? Yeah, a few people. So what that means is it's a multiple employer welfare arrangement. It's kind of the acronym. Essentially, it is just a pooled employer plan. So it's taking a bunch of different employers, putting them together in one pool where the risk can be shared across all of those different employers. So we've had this plan in place. The Indiana Chamber has had this plan in place alongside the Indy Chamber for our members since 2019. And what is new and exciting is that we now have, we've made the decision to roll it out to external partners like the Martinsville Chamber. And we now have 34 different local chambers around the state that have signed up to be partners of ours on this plan. So we're excited to work with Jamie and team to present this to you guys. It is governed by a trust, so the kind of the financial underpinnings of the decision making happens at the trust level, which is made up of leadership from both the Indiana and the Indy Chamber, plus some participants in the plan. So business leaders that are part of the plan sit on the board of trustees and get to make decisions on behalf of the folks in the plan. And the really important thing to note is that those trustees are fiduciaries, right? Does everybody know what a fiduciary is, more or less? So the only, there's no financial incentive. They have to make decisions based, the best decisions for the folks that are in the plan and participating in the plan. So that's really important and a really important distinction as we move forward. Like Brian mentioned, it's available to employers with 2 to 50 employees. So it's really it's an offering that's supposed to be an alternative to Affordable Care Act plans or marketplace plans since the inception of those in the early 2010s. And it's a self-funded plan, but it feels a little bit like a fully insured plan. So, what that means is it's kind of you have predictability, you have fixed premiums that you pay each month. There's stop loss coverage that can mitigate any kind of catastrophic claims or catastrophic risk. And then what's really kind of, I think is really important with this plan, and something that the trustees are very interested in, is that any excess funds that the plan produces are held by the trust, and not by any vendor or anything like that. So what we're able to do is, based on the performance of the plan, we're able to use those assets to return those in some manner back to the participants. So could be in the future there might be premium holidays for all of the groups that are in the plan. We can add on some additional benefits on behalf of everyone in the plan. So that's a pretty key thing that we're able to do under this arrangement as well. So touched on a few of these, but really the core value proposition of the ChamberCare plan is, number one, we have cost-effective rates that you might only find kind of if you were a larger business, but it's underwritten. Each plan is underwritten for the small group market. What that means is that everybody that comes into the plan is underwritten based on their experience, their health experience, their census, who's enrolled in the plan, and that's really kind of why the plan works. And I'll jump ahead, but you see a lot about stability and financial protection on here, predictability. That's really why this plan works. Each one of these plans is individually underwritten, and it's a great offer. It's a great opportunity for groups that are, maybe a little bit healthier, that would not have a great experience from a cost standpoint on an Affordable Care Act plan. They can get lower premiums in this plan, and then once everybody's in the plan, you have the stability of the overall pool that can really help keep costs down. So we'll get to that in the next slide. A couple other things on here. We're really kind of leaning into partnership and making the experience local. With our new partners, we've got local TPA or claims administration and kind of the insurance piece of it in SIHO, based in Columbus, and these guys will talk a little bit about that. We've got, backed by the Indiana and the Indy Chamber, and we've got, like I mentioned, 34 now local chamber partners. And then we're having conversations with local health systems, and really just trying to pull together all of these local entities to help keep healthcare costs lower. Okay, so give you a quick kind of overview of how this plan works, how it's different from other plans in the market. So in a MEWA plan, like I mentioned, you've got a shared risk pool, and you've got everybody in the plan has been underwritten based on their risk, right? Compared to the Affordable Care Act plan, which uses a community rating. So it's kind of just dependent upon that. Those plans are dependent upon your zip code, where you're located, and that's the rate that you get. So you can see kind of the difference between those two, and how this could be potentially for some businesses a much stronger offering. And then you have the balance funded or level funded plans, where really your business is taking on all of the risk. So it can be a great situation if you have a great very healthy crew and nobody has any health issues over the plan year. But what you can see is kind of from that rate stability, those plans can be very volatile. If you have one kind of bad year, you could see, a small business could see their health insurance costs rise significantly, up to kind of the 40-50% range. Our plan, because we've got kind of the pooled experience and the risk shared across the entire pool, we've been able to keep rates historically low. You can see there we've averaged just under 4.5% since inception in terms of kind of year-over-year rate increases, and that's very significant compared to other offerings in the market. So we think we've got a really great offering. Get to some highlights here, if that wants to move. Oh, sorry about that. So we've got 7 years of proven success with several hundred employers that are enrolled in the plan. Through our partners at SIHO, we have really strong network coverage. And like I mentioned, there's really kind of a local feel to this plan now. That's a real intentional move on behalf of the trustees to really kind of bring this in locally and know that you know Hoosiers helping Hoosiers is a big deal. And so when you pick up the phone, if one of your employees, you know, if you're enrolled in the plan and one of your employees has a issue with a claim and you pick up the phone, you're talking to somebody based in Columbus, Indiana or Indianapolis, right? You're not getting routed to some call center somewhere. So we think that's really important. We've got really impactful kind of add-on programs to help keep costs low for both for members that are participating in the plan, but also for the plan as a whole. So some really impactful RX savings programs that can, you know, lead to free or significantly reduced costs on the pharmacy side. We've got dental and vision coverage through Delta VSP, so that's a really strong network, kind of the best network in Indiana on that front. And then again, you know, we're really focused on that affordability, the stability on behalf of the small businesses, and having a transparent offering. And that's really important to the trustees, the ChamberCare trustees, you know, to make sure that we're being upfront on the performance of the plan with everybody that's in it. So we're really, you know, we're really pleased. We really feel like we're in a good place, and think that this is a good opportunity for small businesses to control that very challenging line item of their budgets, and provide some predictability there. Let me back up a little bit. Sorry. Some quick details kind of on the partnership with the Martinsville Chamber of Commerce and other chambers around the state. So what we have in place now is an opportunity where you, small business owner, can take advantage of the program directly through your membership with your local chamber instead of a membership with the Indiana Chamber or the Indy Chamber. So that's a big deal for local chambers. It gives them a tool to recruit new members, to keep the members that they have, and then, you know, we also are kind of sharing in some of the administrative fees that the chambers collect as well, to provide another revenue source for local chambers. Again, kind of taking it down to the local level and really supporting our local communities, our local chambers, and making a really strong program for small businesses in Indiana. One other thing to point out, again, kind of on that local front, really the mechanism to take advantage of this, and Eric or Ryan, who's talking? Ryan's talking. We'll get into this a little bit later, but you know, another piece of that local ecosystem is working with your local insurance broker. That's really important as well. You might have a trusted advisor that you already work with, and you should keep that relationship, and they can work with us to look at this plan and see if it's a good fit. So we think that's a really important piece of the plan as well. And if if you don't have a local agent that you're working with, then we can help you with that. And I would just say too, I mean, thank you all for coming. If you have other, folks in the community that have a small business, and this could be a fit for them, if you want to share the information and send them our way, we'd be happy to talk to them and answer any questions they have. So I mentioned we've got great partners. Again, we're really excited to be working with such a great company like SIHO. I'll let them talk about, what makes SIHO special, but in the, what's it been now? 8 or so months, 6 or 7 months, 6, 7. Sorry, I had to do it. Because my kids do it all the time. So in the 6 or 7 months since we've launched the plan with SIHO as our new insurance carrier partner, they've just been phenomenal partners, and really we're on a really great path, and think this is going to continue to be a great offering for small businesses. So with that, I'll introduce Ryan Yates, sales consultant for SIHO. Talk a little bit about SIHO, their kind of unique structure, which is again another reason why we're so excited to have them as partners. And then we can talk a little bit about next steps, and if you're interested, kind of what that process looks like. Right? Yeah.
All right, thanks, Brett. And sorry, Brett, to bore you with all the boring stuff. I'll get the exciting stuff going for you now, the insurance and administration side of things. So, again, Ryan Yates, as Brett mentioned, I'm an employee benefits sales consultant with SIHO. I partner with Eric, who's with us here today as well, and we kind of split the state. I've been with SIHO for about a year, just briefly. I spent almost a decade with Anthem, managing different areas of the business there, but the majority of it was working with more larger self-funded municipalities, public schools, and universities. And took the opportunity about a year ago to come to SIHO because I really enjoyed working at the client level with the HR teams and CFOs, and you don't have as much of a flexible, innovative approach at a place like Anthem, like you do with TPA locally here, like SIHO. So I came to kind of help them grow, and then when ChamberCare decided to move to a partnership with us, Eric and I are helping grow this great product as well. So a little bit about SIHO. Been around since the late 80s, and really started to create a cooperative with local providers to manage the rising costs of healthcare. So we are a provider-owned organization. Today we are owned by Community, Schneck in Seymour, and then Deaconess in Evansville. And so we partner with them as ownerships, but we also partner with many other systems and providers throughout the state. We kind of have an expertise in flexible administration. We administer those hospital systems as well as many others, Union, Good Sam, Columbus Regional Hospital in Illinois. So that's kind of where our expertise is kind of complex and really innovative and partnering with administration. We are headquartered in Columbus. We do have some offices in Indianapolis and in Seymour and in Evansville. Eric works out of our Columbus office. I live in Greenwood, Center Grove area, so I report out of our Indianapolis office, which is on Community North's campus on the north side of Indianapolis. We've grown to be, I think this is a little outdated, we're almost 250 employees at this point. And again, we just kind of specialize as a customized, flexible administrator, partnering with employers and agents. So with the ChamberCare MEWA association plan, as Brett went through, we are the administrator for that. The network that we use is called TrueConnect, which is a statewide broad network. We took that in terms of our many preferred networks or direct contracts that are our own proprietary networks that are more narrow preferred networks, and then direct contracts, and have been partnered with Encore Combined, which is a broad statewide network as well. And we took all that, put that together to create a broad statewide network. And so some of the analysis when the Chamber was looking at potentially moving away from Anthem was, and another suitable administrator, we ran some analysis with the network and with repricing and disruption and all of that, and it was very adequate to Anthem's broad network approach. And we have seen success with that in the 6 or 7 months that it has moved over to SIHO with, I think we're in the 95–98% range of claims processing in network. So we know the adequacy is there. We use First Health, which is an Aetna, large PPO network outside of Indiana. So that would be the national wrap or the network outside of the True Connect service area in Indiana. So employees that live outside of the state can access the First Health network as their primary network. And those that live in Indiana that access the True Connect network, if they are traveling on vacation, kids in college, they can access in-network benefits through First Health network outside of the state as well. So it is a in and out of network design. There's not multiple tiering or anything like that. So it is a broad network approach with a in and out coverage. The next couple slides, just want to talk where we really stand out as SIHO and really where we put a lot of our effort in to be great with customer service, member services. And we have a great program that is called the Member Advocate Program. And this was actually, I always say this when I'm talking, one of my favorite things about SIHO coming from a big carrier like Anthem, when you talk about local feel and customer service, member services, is having a human approach with someone that is having lots of problems with a diagnosis or their insurance in general, or understanding where to go, who to see, what their copay is or deductibles are. A member advocate can get assigned to them, and they will work with them throughout their time, whatever issue they're working with, or throughout their time on the plan with SIHO as the administrator. And we take those referrals in any way. The member can refer that, the employer can refer that, the broker can refer that. Internally, there's checks going on saying, hey, we think this person might, benefit from having a member advocate. And the fact that those people are all here in Indiana is, to me, stands out. They kind of know where you're from and can kind of help you navigate a difficult situation or just the difficult insurance world as it is, rather than with a bigger carrier, you might be working with someone from California or another country when you're trying to get some more in-depth help. And then just to kind of expand on member services overall, the majority of our member services team is based in Columbus. We do have some in our Indianapolis office as well. So when members pick up the phone and call, or if they're chatting through the portal or on their app, they're talking with people here locally again. And our member services team really stress quality and auditing these things on a quarterly basis, I believe, and passing many different audits and tests to have these high standards in terms of call time and resolution and accuracy and service, and the average talk time, as you see some of the stats on here. And our Columbus team, it's really cool where they are all sitting. It's almost, to me, it's like in a room with a big scoreboard, and everything's tracked, all these stats, call time, and they're constantly monitoring this. And another neat thing to me, coming from a big carrier, is you can go in as an employer, members can come in and visit with those teams and see how they operate day to day, meet them in person. We take people off the street per se and can come in and help with a difficult claim situation or not understanding the bill, something you're not going to get with a large carrier. And then briefly on employer support or services that are available, we do have a full access web portal where as the employer you can view plan coverage, you can get access to the ID cards, your billing will be through there, any kind of plan documents like summary of benefits, SBCs, you can make eligibility changes, and there's ask a question feature through there. It's a pretty active portal that you can use through an app or on your desktop as well. And then ChamberCareHealth.com is a website that is dedicated to ChamberCare MEWA and just kind of everything that encompasses and what Brett went through today in terms of the product itself, network, hospitals in the network or providers in the network, the directory, the preventative drug lists, the EOB submission guide for crediting of accumulators if you're moving into the plan off cycle. All your dental and vision options are in there, how to find a provider, and all the value adds in terms of virtual care through Teladoc or the EAP program. Plan documents are all in there as well. So it's a pretty interactive website that employers can access, your brokers, your consultants can access those as well. So it has a lot of information in there. And then just lastly, I know from my standpoint, I'll turn it back over to Brett. We do at SIHO, we will work directly with employers as well, but we work with pretty much any agent in the state, from larger agencies to more locally agents for Indy or in Martinsville or Bloomington, to all the way down to just an individual agent that works on his own. If they're not credentialed and contracted with us today, we're happy to do that, and it's a very quick and easy process. A couple of forms for them to fill out, and then they can do business with SIHO. So, like I said, there's not a lot out there that we're not doing business with today, but there are some. So, you have a broker, and you mentioned this, and we don't work with SIHO. We're happy to set that up and work with them. So, appreciate you having me. Let me talk a little bit about SIHO. I'll turn it back over to Brett.
Just to piggyback on one thing I want to point out is that the customer service, the member service, the member experience, we've gotten some just incredible feedback from some groups that have gone through that and had that member advocate kind of walk alongside them during challenging health issues, even in just these first 6 months with SIHO. So we're going to be trying to push some of that out in terms of kind of like testimonials and things like that. But that's been a really great part of the partnership for sure. So next steps, kind of, if you're interested, you want to kick the tires, you want to learn more information, here's kind of what that looks like. So I mentioned, Ryan mentioned the ChamberCare Health website. Again, that's kind of your one-stop shop for all the information. It's got all 21 plans, and all the details, different deductibles and things like that. But really, like, we recommend you find an agent, talk with an agent. They can kind of walk you through the pluses and minuses based on each business's unique situation and work directly with you to find the best fit. But if you go to that ChamberCareHealth.com and explore that, there's a button there on most all the pages that says something like Getting Started with ChamberCare. You can click that, it'll take you to a form. You got a couple options there. Once you submit the form, you'll hear back from me, typically, with a couple options. We could, if you want to just have some time to ask some questions, we can set up a time for a quick meeting, phone call, or virtual meeting. If you have an agent, you can go ahead and start talking to that agent and tell them, like, hey, we learned about the ChamberCare plan and we want to take a look at some quotes. You can go that route. If you don't have an agent, you can let us know, and we'll be happy to connect you with one in your backyard here. So that's kind of the process to get going. Once you've made that connection with the broker, essentially, if you decide it's a good fit and are ready to move forward, again, back to that kind of leveraging the Martinsville Chamber membership, you would indicate that as you go through the enrollment process and fill out the enrollment forms, and indicate that you're taking advantage through your membership with the Greater Martinsville Chamber, and that will make that connection. The plan year, just real briefly, and then we can happy to open up for any questions. This is on a 10/1 renewal date every year, so it's a little bit different from your kind of typical calendar year plan. But you can enroll anytime during the year. And in fact, we offer an extended rate guarantee. So for any groups that enroll between May and September, their rates are good all the way through September of the following year. So again, kind of can really support that stability that we're so well known for. So with that, I want to say thank you. Thank you, Jamie, for the opportunity. And on behalf of Emily, I'll say thank you also in the Indy Chamber. But we're grateful for the partnership. We look forward to growing this and to working with as many of you guys and lots of partners around the state to really make an impact on health insurance access for small businesses. We in the chamber world, we're here to help businesses thrive, and that's one way I think we can really make a big difference. So that's what we're trying to do, and we hope you'll come alongside if the fit's right. If not, that's okay too, because health insurance is complicated, and there's no kind of one solution, silver bullet solution for everybody. But we hope we'll give this a try and see if it's a good fit. So with that, I think we can answer any questions if we still have time, or I'll let them answer questions because.
Well, I was just going to mention, because it seems to be confusing at times, the plan renews in 1 year.
Yes.
But it's calendar year deductible.
Correct.
Health insurance.
Yeah.
So that's a calendar year, so that's January to December. So, but if you come in at a different effective date from a different plan already have coverage, we will credit those. If you got $1,000 deductible today, you come to the ChamberCare 8-1, and go to a 2,000 plan, we'll take that, what you've met over, so you only have to meet whatever's left on the deductible for the rest of the year, and then it resets in January. But I just want to clear that up, because it's very
That's a good
confusing.
point.
It renews in October, but our deductibles don't reset in October every year.
Good to know.
Anything else? Any questions? Yes, sir.
Mentions that it's 2 to 50 employees. Are those full-time equivalents or actual numbers?
Yeah, full-time equivalents. Anything eligibility-wise? We can talk about that a little bit.
So it's group insurance, so we have to have 2 employees at least on the plan. But yeah, from an eligibility perspective, you have to have less than 51 eligible full-time employees.
And then some other eligibility rules apply, like 50% participation plus 50% of the premium coverage has to come from the employer. So the employer has to pay for at least half of the premium for their employee. Very standard for most group insurance plans.
50% for employee only, dependents doesn't have to be.
True. Yep. That's why we bring them along. They know all the technical details. Any other questions? Okay. Well, Emily, I think, walked around kind of a flyer. It's kind of one of the marketing pieces that we provide our local chamber partners. So you've got that. I think the QR code on there will take you to the ChamberCare Health site, and I encourage you to explore that. Share it with your friends, colleagues in the community, and again, thank you for having us today.